This is a recently patented angle correction abutment system. This is a demonstration of fabricating the custom abutment. The first thing that is done is we're taking the retention platform and we're tapping it. In this case, we're tapping it with a 1.4 millimeter tap to accept the multi-unit abutment screw. We've now placed the abutment into the model, and it's being marked to be trimmed so that it corresponds to the angle we need to make the abutment. Then we're going to verify that we've made all the necessary corrections of the UCLA abutment. In this case, we had to make another modification because mesial-distally there was still a bad angulation. We're now going to use the secondary cylinder and attach it to the retention platform. We're using the secondary cylinder to help us just position the platform onto the abutment that we've already modified. This case is showing a guide pin, which we're no longer using. We're using the secondary cylinder in place of that. Once we have the platform in place, we then go through the wax up of the rest of the custom abutment. We're going to then finish cleaning the abutment, replace it into the model, and verify the angles of the abutment. In this sequence, now we're trimming off some of the retention platform that is not the proper shape. Now verifying the position of the screw hole and the emergence profile of the abutment. We've replaced the soft tissue on the model, compared it with the adjacent crown to make sure that the abutment is in the position that we want to allow for fabrication of the permanent crown, and to verify that the screw hole is in the position that we want. Sometimes it is necessary to do some type of small gingival procedure on the lingual of these anteriors if you don't have enough room for the platform. Once the abutment is cast, it's dried onto the model. We're then going to take the secondary cylinder and screw it into the abutment and verify that the screw hole and the angulation is where we want it. As you can see in this picture now, the screw hole is coming directly through the lingual. We then have to modify the secondary cylinder because it is way too long, obviously, for the lingual of an anterior tooth. We're going to then replace the secondary cylinder that's been modified onto the abutment, and then we will start the waxing process for the metalwork of the crown itself. We're blocking out the screw hole with a higher temperature wax so that when we wax over it, nothing gets into the screw hole. And then we're placing a layer of separator over both that wax and the metal abutment. And we begin the waxing process of the crown framework. We're now going to remove the wax up from the abutment, and we'll also take out the red wax plug that blocked the screw hole. And now you can see on the inside of the wax up that the screw hole is exactly where we've positioned it. This is showing you the inside of the abutment with the secondary cylinder now modified to fit that particular tooth. This is now ready for casting. A final verification is done prior to the casting procedure by placing the soft tissue back on the model and the adjacent crown that is on the natural tooth to make sure we have all the proper contours that we need for the implant crown. Following the casting, the crown is then fabricated, and you can see on the inside the secondary cylinder that's been incorporated into the metalwork. And the screw hole, instead of going through the buccal of the central, goes through the direct lingual right in the cingulum area. Putting the crown back on the model, it shows you where the screw hole is, and we simply take the multi-unit abutment screw and screw the crown back onto the abutment. Should this abutment screw come loose and the crown comes loose, now we'd have a fully retrievable crown that we can simply unscrew to tighten the abutment screw. This is one of the biggest nightmares that we have in dentistry, and this is a very, very simple solution to that problem. It also eliminates the need for cement, which, as we've said before, cement retained underneath the soft tissue causes a lot of implant failures. The system also can be used for multiple units. This is a case of 2 implants placed. The angulation certainly not ideal. We've placed 2 UCLA abutments. We're marking them so that they can be modified in the proper angulation that we need. They're being placed back on the model to check the angulation of the 2 abutments. The important thing to note here is that both of these are engaging abutments. These are not non-engaging abutments, which even if they could be used, which they could not in this case, you are using engaging abutments which allow you to use the interface between the abutment and the implant, which makes everything more retentive. We've decided in this case to use a larger screw to retain the crowns since this is a bridge. We're modifying the UCLA abutments. We take the 2mm tap and we re-tap that opening with a 2mm tap so it'll now accept the Straumann SCS type screw. This is just demonstrating placing the SCS screw into the platform prior to casting. Once you've tapped it, the fit is very good right from the beginning. I've now taken the secondary cylinder and I'm going to screw that onto the retention platform, and I'm going to use that as my handle to help position the retention platform onto the abutment. This is what we're doing now with all of the abutments, whereas in the previous picture we used a guide pin, which is really not necessary. You can just use the secondary cylinder in the same fashion. We now determine the position that we want the screw holes to go, and we're now waxing the secondary cylinder holding the platform into the position we wanted on the implant abutment. Since this is a multi-unit prosthesis, we're going to tap the second platform with the 2mm tap. We're now using the secondary cylinder to position the other retention platform and putting it parallel to the first one that's already been positioned. And we're putting this screw hole on this exactly where we want it also. Once both the retentive platforms are placed, we're going to then verify to make sure that the screw holes are parallel and that the position of the screw holes are where we want them to end up in the final prosthesis. Once this verification has been done, we're going to proceed with the waxing of the understructure as we have in the other cases that we've shown. As you can see from the picture, the cylinders are both perfectly parallel now, which is quite a difference from where we started. Once the abutments are cast, they're placed back on the model, the fit is verified, and also it should be noted again that these are both engaging abutments. They're not non-engaging abutments. We've now cast the overstructure for the bridge work. It's placed back on the model, and as you can see, the screw holes are exactly where you want them. And we've taken these 2 implants that were very misangled, and we've made this prosthesis totally screw retained and reversible. The final metal work is tried in the mouth prior to placing the porcelain. Following that verification, the case is completed. This final case shows a lower single molar where the screw hole actually would go through the distal lingual cusp of the molar. You can see with the UCLA abutment place the angle that we're dealing with. If you made this screw retained, if you see the position, the screw hole would be going through the distal lingual cusp and you'd have unsupported porcelain. This leads to the porcelain fracture. This is a case that presented to me with exactly that result. So I removed the crown, went through and used this angle correction system, and I repositioned the hole where it belongs. Here we're going through the same process, modifying the UCLA abutment. We're using a 2mm screw in this case, and that's tapped. We're now taking the secondary screw, screwing it onto the platform to again enable us to simply position the platform onto the modified abutment. In this particular case, the edges of the platform were not letting us get it in the position we wanted, so they can simply be modified here just using a scalpel blade to just take off a little bit of the edges of the retention platform. Now, utilizing the secondary cylinder, we're putting the platform in the position so that we can now put the screw where we want it in this crown. The rest of the process is all the same. We're going to wax up the crown portion. Once that's done, we've cast the abutment. We're going to take the abutment and we're going to take the tap and we're going to re-tap the holes to clean the oxides out from the casting. As you can see, this is done very simply. And this again is a 2mm tap, so we're using a SCS screw for the retention of this crown. We're now placing the abutment onto the implant, and you can see the position of the screw hole compared to where the abutment angulation would place this screw. We're now taking the secondary cylinder and placing it into the predetermined opening in the center of the crown. The secondary cylinder is modified as needed. It is then placed back onto the abutment, and we will continue with the wax up for the crown metalwork. The technique is all the same. Separator's placed, the screw hole gets plugged, then the framework for the crown is then waxed up and completed. We've now completed the wax up and are removing the wax up, and we'll remove the small plug that was in the screw hole. You can see the secondary cylinder incorporated into the metalwork for the crown. This is now ready for casting once any further refinements are made. Once the metalwork is cast, the porcelain is put on. We're screwing the crown onto the abutment with the screw hole going right through the central fossa. This crown is now ready for delivery. This has solved many, many problems I think we've all seen. Give it a try. You'll be happy you did.